Yo, what's up, y'all? Ruben Davis, future doc here, and I'm super excited because in today's video, I'm officially launching my note-taking app, Docpad. And in this video, I'm going to talk about why I created this app, and then I'm going to walk you through the app and show you all the great features that it has to offer. Let's get right into it. All right, so I created the app because I myself realized I needed a better way to create a system for myself on all my rotations, right? Because if you watched one of my previous videos about, tips on how to honor your rotations, one of the biggest things there is having a system, right? And so this allowed me, and it can allow you as well, to create a system for yourself so that you go through things when you're admitting a patient and you're interviewing a patient or whatever, you go through all your things and you don't miss a beat. It's customizable. There are pre-built in templates. There are lots of features to help you be successful when creating your plans, be successful when presenting, and to ultimately honor your rotations and just feel like a competent med student, resident, even attending, as it works for anybody who just wants to get down patient data fast, efficiently, and easy. All right. And so let's just dive right into the app so you can see for yourself what Docpad has to offer. All right, so when you're first using the app, you'll be prompted to either sign in or sign up. All right, but I'm already signed into account just for this walkthrough demonstration. The first thing you'll see after you sign in is your patient census page, which will have all your patient notes lined up for you, right? And as you see at the bottom, have your other options, but we're going to just dive right into the patient notes real quick to show you some of those features. All right, and as you can see, you got the patient initials, room number, and chief complaint right there to kind of keep you refreshed, and then even some to-dos, which we'll go through later. All right, so in the patient notes tab, right, so in the note section of this, so there are twos, there's the note section, there's the do section, and then the edit and present tabs, and we'll go through the editing of the note section first, right? And so in this note, what you can do is you can see you add your name, a third person, all the way at the top here. And then you can do room number, and then you can add a past medical history. This is one of my favorite features here, where you can do, it's a one-liner generator, right? So let's see what I have here. I have a 68-year-old, okay, male, okay. Let's say hypertension, and then diabetes mellitus, right? Here for a complaint of, let's say down here, chest pain, right? Let's say 2 hours. And as you see, as I'm putting all that information, there's a one-liner generator that kind of makes that one-liner for you to kind of just streamline the process, right? And then you can put your HPI data in there, whatever notes you take as you're interviewing. And you can also, when you're setting up your templates, you can put prompts in there to remind you to ask certain questions. So every time you open up that template in a new patient chart, you'll get prompted with those same sort of questions to make sure you go. Then you can go through your review systems. Let's say they got no fever, no chills, but some night sweats, right? I don't know. I'm just showing you some of the features here. No headaches, no dizziness. So you double tap to get to the negatives, right? And then you have your MSK stuff, right? And then if there's not things in those systems that aren't listed, you can just add a custom. And let's just say they talked about eye twitching. I don't know. And I just want to add that. And you see, boom, eye twitching right down there at the bottom of the screen. You can add in past medical history, medications, allergies, all the things, right? And then you come down to your assessment and plan, and then let's get into the assessment and plan. So what labs we want to get? Let's add, so I clicked on it twice, so that's why these generated twice. But let's say CBC, BMP, troponin, right? Some of those things, whatever things you want to add, right? And I clicked on labs again. But let's just say, and then this is kind of help you think of all the things. Let's say we're just going to say EKG, clicked on EKG. Now I'm ordered that. ordered fluids, and then you can put in that DVT prophylaxis, nutrition, right? And then the beautiful thing about all of this, you put in all this information, right? And then the best part is you go to the present tab, and now everything is listed out beautifully for you in a more easy to read presentation format, right? All the labs, all the things in the order that you want it. And so when you go to edit sections as well, you can edit the sections that you want real time. Let's say you don't want allergies. You can just take that out. Boom. Now you go back to your edit tab. Boom. Allergies are gone, right? And that gets rid of some of the fluff. So real time, you can edit these sections. It's fully customizable just for you, but then you can also make your pre-formed templates, right? And so then you get your to-dos. And so you want to check that troponin, cardiology, consult, follow-up, whatever it is. You can put anything in there, and then those will actually show up on those main pages, and you can check things off as they come up, right? And I just, it really helps me out a lot. I actually use this all the time now. I use this every day. I got rid of the pen and paper, and this has really been my main source of note-taking for the app. All right, and I think it can be a great app for you too. And let's talk about templates, all right, in this next tab down here. So templates, I have pre-made templates for the various specialties, right? Internal medicine, surgery, neurology, pediatrics, family medicine, all the things. And then you can make your own custom ones too, right? And like I said, the HBI prompt that you can put, that'll be pre-existing when you open up this for a new patient, right? But so you can do all that customization. I'm not going to go through it too much, but then you can pick which sections you want. We got different, and then you can change the order as well. And then you can create your own custom section using some of the same sort of preset types. So like either it's a free text one, the tile editions, you can create your own custom sections as well for your own custom templates that are just for you, just for your school, your rotations, and whatever your attending likes, right? So if you find your attending like something and your attendings are constantly changing, you can make templates just for that attending, right? Dr. Gonzalez likes this, so I have a Dr. Gonzalez template for internal medicine. I have a Dr. Davis template for surgery, so you can do all of those things, whatever you want, right? And so now, then we have the Learn and Think tab. Okay, the Learn and Think tab is really for you as you get pearls or different learning points on rounds and different things you want to remember. You can put that in here, right? So for this one, always check a trope and EKG for chest pain, right? And I'm just gonna put that in there, right? You can save it as various different things, and now that's in here. And then as those stack up, you can start to search those pearls and little various things that they teach you on rounds, right? Like they're teaching you about how to calculate cerebral perfusion, and you want to remember some of those notes and things. You can write them down, but that piece of paper tends to get lost, but you can put it right in here and it'll save, and then you can search it and name it and do all the things you want to do, right? And then, different medication things. It can be dosages or stuff, whatever you want to do. Then one of my other favorite features is the plan checker here, right? So you come over to the plan checker section, and these are basically prompts to help you think through your assessment and plan and every day to make sure that you're thinking about the things that you need to think about, right? Some of the things that I feel like I would always forget that I included in my system was making sure I'm always thinking about nutrition and thinking about toileting, GI stuff, pain, make sure that we're addressing certain things, disposition. And these questions kind of help you think through that in various stages. So the problem, like, are we addressing the problem? Is the problem urgency? Has the urgency changed? Is it getting worse, right? And then you can customize these as well. You can delete these. These are ones that are already in there, but then you can add your own, and you can delete the ones that are already there, right? The body, are we thinking about prophylaxis? Are we, all the lines and tubes, do they need to still be in? Do we need to take those out, right? Is there anything else we need to follow up on, right? Pending labs. What are the goals of care discussions? That's really important. Like in the ICU, for example, like goals of care discussions with the family and the patient. And then obviously just some settings and things that you can put in there, right? So yeah, that is Docpad. I think I created this app for med students primarily, but really residents, attendings alike could also use it. It's really a tool to help you organize yourself as a student for presentations, right? If you're someone who struggles with keeping your patients organized and then getting all your data, make sure you're not missing data when you're presenting and missing data when you're doing your chart reviews. This helps you keep a system for yourself to make sure you're going through everything you need to go through, get all the information you want from rounds, and then pivot and adjust as you learn more and you figure out what works for you, right? It's fully flexible, fully customizable to help you be successful on rounds. I've had people use it already who tested out who said that it was great for them. They're like, wow, they love all the features. They love how they can just click on that present view and everything goes according to plan, right? So with that said, please comment down below if you like this, if you have any features that you want added to it. You can click on the link in the description to access the app right now. You can get your 7-day free trial of the app, and then after that it'll be $5 a month, just $5 a month to use to be that much better on rounds and to really wow folks on your rotations. Okay, I'll be making more content about the app and more other things. I hope that this app can be extremely useful for you and help you be successful. All right, make sure you like this video, comment down below whether you think this would be helpful for you. If you do start using it, come back and comment, leave a comment, and let people know whether it's good or not. I'm accepting all the feedback and ways to improve it, and you know, all the things, man. I'm just really excited to get this out there and to see how it can help people be better. All right, so appreciate y'all tuning in. As always, Future Doc.